You're sick in Iowa, facing a choice: urgent care or the emergency room? Your decision could be the difference between waiting minutes or waiting hours. But wait time and even cost are only part of the story. The most important difference is what each facility is fundamentally designed to do. In the next 5 minutes, we'll give you a clear framework so you always know exactly where to go. Let's start with urgent care. Think of it as the place for problems that are serious, but not life-threatening. This includes colds, the flu, sore throats, and sinus infections. Also, allergies, rashes, and urinary tract infections. It's also for minor injuries like sprains, strains, and small cuts or burns. The Iowa Clinic even includes back pain on their list. Now, let's define the emergency room's critical, distinct mission. The ER is for severe, life-threatening, or potentially disabling conditions. Think chest pain, difficulty breathing, or continuous bleeding. Also, sudden weakness or vision problems, severe head injuries, or suspected heart attack or stroke. So why is the ER the only choice for these crises? It comes down to two things: staffing and specialization. First, Iowa's ERs are open 24/7. They are staffed with personnel specifically trained in emergency medicine. This isn't just general training. These are dedicated teams for cardiac events, stroke, and major trauma. This specialization is backed by immediate access to advanced diagnostic testing and on-call specialists from across the hospital. So how does urgent care's setup differ? They are designed for breadth and efficiency, not life-threatening emergencies. Their on-site X-rays and lab tests are for confirming a fracture or testing for strep throat. These tools serve the urgent, not the emergent. Urgent care clinics see patients 3 months and older for minor illnesses and injuries. They offer walk-ins and even virtual visits for convenience. So how do you decide in the moment? The core question is this life-threatening? Iowa Total Care puts it simply: if you even think it's an emergency, go to the ER. It's always better to be cautious and have an ER tell you it's not serious than the other way around. But there's one more layer to this that every Iowan should know. Not all emergency rooms are created equal. Let's talk about trauma levels. A hospital like Iowa Methodist in Des Moines is a Level Y adult trauma center. This is the highest level of care available. It means they have the resources and specialists on site 24/7 to handle the most complex multi-system injuries like severe car crashes. Other hospitals may have a Level 4 designation like Iowa Lutheran. They provide evaluation and stabilization before transferring a patient. This is what that specialization we mentioned earlier truly means. It's a network of care, with different facilities playing different vital roles. Now, let's bring it all together. Remember the very first thing we talked about? Wait times. When you choose an urgent care for your sprained ankle or your child's fever, you aren't just saving yourself time and money. You are actively helping keep a bed open and a specialized team ready at that Level 1 trauma center for a stroke victim or car crash survivor. Your correct choice is not just good for you. It makes the entire Iowa healthcare system stronger for everyone. So to recap, for the urgent but not life-threatening, sprains, fevers, infections, minor cuts, think urgent care. For anything that feels potentially life-threatening, chest pain, trouble breathing, severe bleeding, stroke symptoms, go straight to the ER. Do not wait. When in doubt, always err on the side of caution and choose the ER. Trust your instincts. It's the safest choice. Knowing where to go is vital knowledge. Share this video with your family and friends in Iowa. It could make a critical difference when it matters most.